It is now my distinct honor and pleasure to introduce Dr. Stephen Perlman, who will deliver our 2009 Commencement Address. Dr. Perlman is known worldwide as an advocate for the oral health of people with disabilities. In 1993, Dr. Perlman worked with the Henry M. Goldman School of Dental Medicine and Special Olympics founder Eunice Kennedy Shriver to create Special Olympics Special Smiles, a program to provide on-site dental screenings to athletes at the Special Olympics Massachusetts Games. Since then, Special Smiles became part of Special Olympics Healthy Athletes, a larger initiative to improve athletes' overall health and fitness. Now an international program, Special Smiles also seeks to break down the barriers that too often prevent dental care professionals from working with people with intellectual disabilities. Dr. Perlman received a Bachelor of Arts in Psychology from the George Washington University in 1968 and a Doctor of Dental Surgery degree from New York University College of Dentistry in 1972. In 1976, he graduated our own Henry M. Goldman School of Dental Medicine with a Master of Science in Dentistry and a Certificate of Advanced Graduate Study in Pediatric Dentistry. He also completed 2 years of military service between dental school and his postgraduate work as a lieutenant in the United States Navy Dental Corps, something that is certainly near and dear to my heart. Immediately following graduation from Boston University, Dr. Perlman became a clinical instructor of pediatric dentistry at our school. In 1987, he was named a clinical assistant professor, and in 1995, a clinical associate professor. I am now very proud to call him Professor, having just very recently been promoted to clinical professor. In addition to his work with the Special Olympics and at the Henry M. Goldman School of Dental Medicine, Dr. Perlman maintains a private practice limited to pediatric dentistry in Lynn, Massachusetts with Dr. Michael P. Coyden. Dr. Perlman's awards are numerous and well-deserved. I will share with you just a few of his most recent honors. In March 2009, Dr. Perlman received the Chicago Dental Society's George Cushing Award, which recognizes those who raise public awareness about the importance of oral health. In 2008, A.T. Still University, Arizona School of Dentistry and Oral Health presented Dr. Perlman an honorary Doctor of Humane Letters degree. In 2007, Dr. Perlman received the Special Spirit in China Award, Special Lifetime Global Leadership in Promoting Human Dignity from Special Olympics. On this occasion, he shared both the award and the stage with California Governor Arnold Schwarzenegger and performer Vanessa Williams. Also in 2007, Dr. Perlman received the MARC Person of the Year Award from the Arc of East Middlesex in Peabody, Massachusetts. Dr. Perlman's dedication to working on behalf of underserved populations in Massachusetts and now the global community makes him an exemplary Henry M. Goldman School of Dental Medicine alumnus and dental professional. He is truly a role model whom I encourage you to look to for guidance on what you can and should do to serve our communities after your graduation. He is the very model of professionalism for a dental practitioner. His standard of care, ethical behavior, and professionalism is one in which we should all aspire to. As you begin your journey today as a dental professional, I know that the address Dr. Perlman is about to make will be an inspiration and a guide as you endeavor to start or join a practice and conduct yourself in a manner befitting a graduate of the Boston University Henry M. Goldman School of Dental Medicine. Please join me in welcoming Dr. Stephen Perlman.
Thank you. Dean Hutter, Reverend Enquist, distinguished faculty, graduating students and residents, family and friends. Thank you for the honor of welcoming my new colleagues of the 2009 class of the Boston University Henry M. Goldman School of Dental Medicine to our profession, as well as those completing their advanced standing and specialty training. This honor is especially significant for me because 33 years ago, I completed my specialty training from this same institution. How did this school that you are about to become both a graduate and an alumni evolve since its beginnings in 1958? What was the lineage, the drive, the spirit, and the dreams of the people behind the mortar who founded this unique institution? The Boston University Henry M. Goldman School of Dental Medicine is its present iteration. And before that, it was the Boston University School of Dental Medicine. In 1963, it became the freestanding Boston University School of Graduate Dentistry under the leadership of its visionary and founder, Dean Henry M. Goldman, and continuing for 30 years under Dean Spencer Frankel. It is a privilege to be here today with our third dean, Dr. Jeffrey Hutter, who will bring his own vision to our school. But its most intriguing name, and the one I want to talk to you about today, was its original outgrowth from the Boston University Medical School, when in 1958, it was simply the Department of Stomatology to provide postdoctoral education in dentistry. It's expected of me in delivering this keynote address, as it is expected of the thousands of others delivering keynotes across the country at this time of the year, to talk about passion, to talk about my hope and your need for you to develop, nurture, and maintain passion in your work. It's expected of graduates at this time of the year, especially those about to enter the noble professions of medicine, law, and dentistry, that passion is the reason, the only reason, that you will continue to be nourished in your endeavors. But I'm afraid I will not profess to you that passion is the ultimate vehicle you will need to be nourished, anointed, and rewarded for your efforts. It is not passion that will be the key to your happiness as a dentist for the next 30, 40, or 50 years. And while that might sound strange from someone who has been described for years as being passionate about what he does, I will not and I cannot stand in front of you and urge you to be passionate about your profession. Instead, I direct you to the observations of Robert Sternberg, who mused that passion is the quickest to develop and the quickest to fade. Intimacy develops more slowly, and commitment more gradually still. And so I urge you to be intimate and committed to what you will do, to become intimate with your skills and intimate with your personal goals, and committed to your profession, and lastly, committed to your patients. At the end of the day and at the end of your lives, it will be this intimacy and commitment wrapped in passion that will allow you to hold your head high and maintain that high level of self-respect and self-esteem that all of us who have embarked on this noble profession deserve. It is also fitting for me to thank your teachers who have enriched and mentored you beyond your beliefs. In fact, most of their enrichment won't be palpable to you for years, when what they said will ring true when you least expect it. And the dentists who came before you will also enrich you. They have enriched the lives of individuals who have been treated for tormenting oral disorders that presented pain, disfigurement, and opportunities to play havoc on the body. And finally, your patients, past and present and future, who have and who will enrich your lives by providing you both the opportunity and privilege to care for them and contribute to their well-being. This is immeasurable enrichment, and I ask you to always reflect on this sacred relationship. Hopefully, you will go on to enrich the profession, an obligation we all assume when the community recognizes us as doctors. It's great to be a dentist in this era. The number of dentists can't keep up with the growth of the population. The technology now permits you to provide treatment for patients that older practitioners could only dream, and the financial return keeps improving. Aesthetics, cosmetics, and implants are the focus of magazine articles, advertisements, and other media, and of course, dental spas and designer offices. But the most important thing is to make your office a dental home. You can buy the most beautiful, expensive furnishings and equipment. Yes, money can buy a house, but it can't buy a home. Make your dental environment accessible, person-centered, compassionate, comprehensive, communicative, continuous, evidence-based, interdisciplinary, cost-conscious, outcome-oriented, culturally competent, choice-contingent, and kind. Make it a home, since this is where you will live and share your skills. But what are the real important issues in dentistry today? Our origin, the department, this school of stomatology, or SOS, is a fitting segue into my remarks about another SOS in dentistry today. The initials SOS, the Universal Distress Call, should serve as much as a call to action as a call for alarm. Tooth decay continues to remain the single most chronic disease of childhood, causing untold misery for children and their families. Less than 1 in 5 Medicaid-eligible children are able to receive dental services each year. Almost 80% of decayed teeth in preschool-aged children living in poverty go untreated. Race, ethnicity, socioeconomic status, and health insurance continue to be the most powerful predictors of poor health care access, health, and vulnerability. African Americans have double the infant mortality rate, deaths related to diabetes, and exhibit a 30% higher death rate from all types of cancers than whites. They also have a higher death rate for HIV/AIDS and cardiovascular disease. 42% of Army recruits today are not deployable due to dental problems. The life expectancy for a white adult with Down syndrome is 55 years of age. It is 25 for a black person. Unfortunately, I could go on and on. The dental SOS, which I wake up to and for every day, is actually a dual distress call. The first one is the distress that is represented by our profession not providing access to competent and comprehensive oral health care to the 65 million people with disabilities, including 7.5 million children and adults with intellectual and developmental disabilities. The #1 unmet health care concern for people, what is most familiarly known as mental retardation, is dental care. We as a profession have largely ignored the SOS that has been sent up by their advocates, their families, and those individuals who very often can only express their mounting pain by banging their heads in futile communication skills. Because dental education has ignored this population, many of you have never experienced the joy and the rewards of treating patients with disabilities. Dental education has been grueling, arduous, and demanding, and although it's unfortunate, one of the byproducts of that journey is to drive you away from the fundamental reasons you first considered dentistry as a life's calling. The exhilaration of helping someone, the resounding buzz of enriching the quality of life for someone with a pain that the poet Robert Burns described as tearing my nerves with bitter pang, like racking engines. Many of you will never see the expression of thanks in the eyes of someone who cannot say it any other way, or not feel the scintilla of knowing that you and you alone stopped the flow of psychotropic drugs erroneously prescribed to stop the sudden onset of self-abuse, when all it took to stop it was to curtail a brewing or sinister oral infection that no one thought to find. Many of you may never see the joy on the face of parents when you smile and say, "Of course, I'll treat your child." And many of you may never turn off the lights in your office at the end of the day and walk out knowing that you and you alone were able to break through the sensory divide that holds hostage people with special health care needs. And maybe, just maybe, when we were only the school of stomatology, teaching the physiology and pathology of the mouth, that it was understandable. But our mantle, that of a school of dental medicine, means that we have to respond to this crisis, this shame and embarrassment, this national and yes, international SOS. The other side of the SOS is that oral health care of at-risk, low-income children is still not being addressed. It is distressing to me that for all the collective efforts of dental researchers, dental school faculty, dental organizations and associations, as well as practicing dentists, to create strategies and programs to close the gap and ensure that at-risk children, including children with complex intellectual and developmental disabilities, who probably represent the highest risk, that this proverbial ball is still being dropped. Dentists simply ignore this segment of the population in clinical practice and in dental research. For children at risk, the biggest risk factor is that they will become adults at risk, because that is where we find the unanswered SOS. What is the sense, the rationale, the economics, the wisdom, and the humanity to provide the needed resources to ensure that children have opportunities for health development when we set them adrift in leaky rubber rafts in the dark, hostile, and angry seas that we call adulthood? While SOS is generally, but erroneously recognized as an acronym for Save Our Ship or Save Our Souls, I have another acronym that I would like to offer you. SOS, Save Our Smiles. Save that one feature of our face that announces that we are healthy, that we are happy, that we are cared for and about, that we are valued, and that who we are and what we do matters. That it matters to you, graduates of a school that long ago was simply a school of stomatology and is now a school, a world-respected school, a renowned school, and a remarkable school of dental medicine, and that you, all of you, are now doctors of dental medicine. Go forth and save their smiles, perhaps beginning with a commitment to save one. I promise you a legacy that as you save one smile, you'll preserve another, a private one, the one you'll see every morning, the one in the mirror who year after year will be reflecting on who you've become. In conclusion, I would briefly like to give you the last quiz that you will take here, as it relates to three significant historical figures In the evolution of the art and science of dentistry, it should be a snap for you. The first question is, who is this? The answer should flow from your lips. This is Pierre Fouchard. He is credited to be the father of modern dentistry. Fouchard is credited with writing the first complete scientific description of dentistry called Le Chirurgien Dentiste, or the surgeon dentist. In the 1700s, he described the basic oral anatomy and physiology, signs and symptoms of oral pathology, operative methods for removing decay and restoring teeth, orthodontics, periodontal disease, replacement of missing teeth, and tooth transplantation. And he proved that tooth decay was not caused by tooth worms. So he is a guy that you should know. Okay, maybe that was a tough one, but this one is a giveaway. Who is this? This is Green Vardaman Black, or G.V. Black, the father of American dentistry. A cool guy, he developed the original mixture of amalgam that many dentists still use today. He developed the dental drill, driven by a foot engine, and pushed for formal education. He became dean of the Northwestern University Dental School, and he was a physician to boot. While I can forgive you for blowing the first two significant figures in the world of dentistry, you absolutely, without an exception, need to know who this next figure is. This is Diamante Driver from Maryland. For those of you who don't know who he was a 12-year-old boy who had an abscessed tooth and couldn't find a dentist to treat him since he had ADD and he was poor. The abscess spread to his brain, requiring surgery, which resulted on his death on February 25, 2007. He endured 2 surgeries and weeks of hospital care totaling over $250,000. When dentists were asked about why they turned their backs on seeing him and treating him, they said, with Medicaid, we don't even break even. While you can forget Fouchard and Black, please don't forget Diamante Driver. My best to you, the graduates of the Boston University Goldman School of Dental Medicine and its predecessor, the School of Stomatology. I wish you all success, happiness, and fulfillment of all your dreams. Thank you.